Giampiero Gaio.
Good morning.
In the background, Marina Battista, Enzo Miceli, and our echocardiographer, Dr. Iacono. This morning we will deal as a first case with a patent foramen ovalis of a 40-year-old lady that my colleague Giampiero Gaio will introduce for you.
Good morning. Can I have the slide, please? The patient today is a 14-year-old female referred to our institution after multi-transitory cerebral ischemic attacks. She doesn't have any coagulation anomalies, and at the transesophageal echo there was a diagnosis of a patent foramen ovale with a moderate shunt after the Valsalva maneuver. The MRI was positive for frontoparietal ischemic lesions, and she's in antiplatelet therapy. This is the transesophageal echo with the patent foramen ovale and the shunt after the Valsalva maneuver. So our intended procedure is to close this patent foramen ovale.
Now, Dr. Iacono will show you the echocardiographic pictures after passing the foramen ovalis with a catheter and guided wire. Please, Carol. Okay, as you can see in these pictures, the patent foramen ovalis that has been crossed with a catheter inside which we put
sorry, but
straight,
we don't see a picture.
stiff
Can
guided
we see
wire.
the echo? Can we see the echo?
Can we see the echoes? Sorry.
No, we can't see that. We see only a slide about the
okay.
intended procedure. Can you switch?
Echo, please.
Could you switch on the echo?
To the echo?
Puoi girare sull'echo?
Yes, now we see it.
Yes. As you can see, the patent foramen ovalis is widely open, and the shunt is mainly left to right, but bidirectional in some time. The atrial septum seems quite stiff, and the opening is not so wide. It measures about 4-5 millimeters after I've been stretched with a stiff guide wire. Our policy in these cases of not aneurysmal foramen ovalis is to probe the aneurysm using a monitor Berman catheter, because inflating the balloon at the tip of the catheter, the balloon measures about 10-11 millimeters. If the balloon doesn't cross across the patent foramen ovalis, we are quite sure to use a 25 millimeter large device. So we save some money, avoiding more expensive sizing balloon in this case. Picture in picture, due immagini anche con il fluoro. Now,
La scopia e l'eco.
both images inside. Now I inflate the balloon, and I am pushing it toward the septum. As you can see, the patent foramen ovalis has been closed, but the balloon doesn't plop across the septum. So we are quite sure that these sides of the device could be good. We decided to use a Amplatzer PFAO colluder 25 millimeter in order to straighten the septum and close the hole. I'm not able to cross the balloon across the septum. Now we will prepare the device and put into the pedum foramen ovalis. Could you open the light, please? Switch on the light.
Accendi la luce. Ok. Telecamera qua.
Now we are trying to prepare the device. As already know, this device is made by a distal disc of 18 millimeters, slightly smaller than the proximal disc, that is 25 millimeter. In the case of an aneurysmal set, I normally prefer to use a multifenestrated unplatzer septal occluder that has both discs of the same size. In this case, I don't think that the device could embolize because the septum is quite rigid and the opening is at maximum diameter of 5.6. Then the half of the distal disc is 9 millimeter and should be enough to avoid embolization from the left to right. After screwing, we can put the device inside the loader and flush with saline, heparinized saline. This patient has been given heparin 2,000 units at the beginning of the procedure. Now we put the delivery catheter through the pedum foramen ovalis, and then we will position and deploy the device. Now we will show you the echo pictures and picture in picture the floor and echo. We're coming up with the delivery system through the foramen ovalis. We cross the septum and then redraw the come back. Okay. We flush with saline in order to avoid bubbles into the left side of the heart. And then we will implant the device. Wait a moment, just a moment. Okay. Picture in picture, yes. This patient, we open the left heart disc and then come back toward the septum. And as soon as the left outer disc applies on the septum, we will free the right outer disc and push on the delivery system. If the position is good and there is no interference at all with the near-bore structure, we will deploy it and free it from the delivery catheter. In this kind of procedure, the anatomy of the septum makes the difference between difficult and quite straightforward procedures. There is some problem with the... Okay, don't worry, we'll do it without the... Okay, we will free the... Okay, let's see the echo. Yes, there is no bubble at all, no shunt at all across the device. We will perform... Do you think it could be necessary to perform a bubble test afterward? Do you hear me?
Yes, we hear you.
Yeah.
We are waiting for the bubble test.
Yeah. We prepare for the bubble test.
How important do you find to perform a bubble test? Because just after the implantation of the device, you very often see still leaking from right to left or left to right. So
yes,
what does
but
it mean?
sometimes
what does it tell you?
Yes, sometimes you can find an accessory hole far away from the patent foramen ovale that is not possible to see before the implantation. So sometimes it is useful to perform a bubble test after the procedure. We do not do it routinely, but sometimes it's necessary. Okay, I go.
Yes,
There is no bubbling crossing at all across the septum. We are finished.
Okay, perfect procedure. Thank you very much.
Thank you. See you in the next
you.
few hours.
Okay. Thank you very much.
Thank you very much.
Thank you.